Our research topic is over hippotherapy. Our research question is, which hippotherapy method is more effective in increasing gross motor skills for children with cerebral palsy ages 0 to 18 years, mechanical simulator or live horse hippotherapy? What is cerebral palsy? Cerebral palsy is a condition marked by impaired muscle coordination and/or other disabilities typically caused by damage to the brain before or at birth. The clinical signs include problems with muscle tone, movement coordination and control, reflexes, posture, balance, gross motor function, fine motor function, and oral motor function. Susie is a 6-year-old girl with spastic cerebral palsy. She lacks postural control, balance, and coordination of her gait. Susie's parents have heard about the potential benefits of hippotherapy from healthcare professionals and other parents in support groups. Susie's parents decided to search the internet, but were unsure about the differences that they found between hippotherapy and therapeutic horseback riding.
The general differences between hippotherapy and therapeutic horseback riding are outlined in the chart. Hippotherapy is led by a trained therapist, used as a treatment tool, and focuses on improving neurological functioning. Therapeutic horseback riding is led by a certified instructor, used as an adapted recreation, and focuses on teaching proper riding positioning and skills. Susie's parents decided hippotherapy would be the best treatment option. What gross motor benefits can they expect Susie to get from using hippotherapy? Susie's parents found that improved postural control can be a benefit of hippotherapy, and it's demonstrated through increased endurance in sitting, standing, and walking, as well as increased ability to run and jump. They found improvements in static balance, which was demonstrated through the patient's improved standing, sitting, single leg standing, and kneeling. Dynamic balance was improved by showing a greater stride length, increased walking speed, as well as improvements in crawling, running, and walking. Increased coordination was improved by the child's ability to roll, crawl, walk, run, and jump through increased pelvis, hip, trunk, and head movements. Hip adductor symmetry was increased, and it improved pelvic and hip kinematics, which led to improvements in gait parameters such as cadence, stride length, and walking speed. These gross motor benefits can lead to other benefits of the child, such as improved well-being, energy conservation, functional performance in his or her home and community. Parents reported that children were able to perform ADLs and were not in their performance range prior to hippotherapy. Overall, self-perception improved significantly. Susie's parents found 2 facilities in the area. One offers live horse hippotherapy and the other uses mechanical simulator. Now they need to decide which one to choose. The general differences between live horse hippotherapy and simulated hippotherapy are outlined in the chart below. General external factors are able to be controlled with live horse hippotherapy, or not able to be controlled. Weather can impact the ability to go out and perform the therapy, as well as the behavior of the horse. Opportunities to engage with the animal are a benefit of live horse hippotherapy, but the therapy may be more expensive. Simulated hippotherapy can be controlled, external factors can be controlled, so the weather will not impact the ability to do the therapy, and the machine can be controlled by the therapist. Simulated hippotherapy does not give the child the ability to interact with a live animal, but it may be a less expensive treatment option.
After doing some research, Susie's parents found that simulated hippotherapy is just as effective as live horse hippotherapy. They also discovered that the benefits of hippotherapy increased as the duration and frequency of the hippotherapy sessions increased. Susie's parents also noticed that many of the studies had small sample sizes and varied greatly in their treatment approaches. They were having difficulty deciding what the best effectiveness formula would be. They wondered what the optimal duration would be because many of the sessions ranged from 8 minutes to 45 minutes. They also wanted to know what frequency would be best for Susie because one of the studies showed one session while many others had months at a time. And they wanted to know what the therapist would be doing throughout the session and what their reaction, the child's reaction, would be to the therapy. The non-effective research findings include barrel sitting. Barrel sitting was not effective because it did not increase muscle activity of the children's trunk, upper legs during sitting, standing, or walking. They also found that physical therapy was more beneficial when hippotherapy was combined than when it was done alone. They also found that hippotherapy did not work well in extremely low-functioning cerebral palsy patients because the therapist had to maintain their hands on the patient the entire time. And lastly, there was mixed results about whether a single session of hippotherapy was beneficial because some of the studies showed that there was significant results while others did not. So, in conclusion, since the research supports both live horse and simulated hippotherapy as effective treatment options, Susie's parents will need to decide which treatment option is best for them and their daughter. So next we're just going to show you a video to demonstrate what hippotherapy looks like in real life.
I'm Peggy Curran. I'm a physical therapist, and I have been with Butterfly Dreams Therapeutic Riding Farm for about 3 years. This is Dink, one of our favorite hippotherapy ponies. Hippotherapy is just another type of treatment. It is usually carried out by physical therapists, an occupational therapist, or speech therapist. We use the movement of the horse to help the person that we're working with meet their regular therapy goals.
Sound like a plan? Good.
The horse is actually chosen by how they move, and how they move and what the horse's gait is helps determine on what we're exactly working on with that particular child.
Sam had difficulties in labor and delivery, and she was a cord wrap baby. The cord was wrapped around her neck twice, and we were having a normal delivery and ended up with an emergency cesarean section. And her first MRI revealed, a little bit of bleeding around her brain, and it was actually her second MRI a few weeks later that revealed all the damage that she incurred in birth. And we have been in therapy ever since then. So we actually determined that she had brain injury to the extent she had about 4 weeks after her birth. Hippotherapy was actually recommended to us by Sam's traditional physical therapist, and she had heard about the center out here and encouraged us to go out here and try it, and it's been absolutely fantastic.
Samantha receives her treatment on Dink. He is a very slow-moving old pony, and so therefore we have very few surprises with Dink. Samantha is very unbalanced with her cerebral palsy, and Dink is very slow, very little movement. With someone with cerebral palsy that may have increased muscle tone, a lot of stiffness throughout their body, what we want to do is to have a nice, even, steady gait so that we can help those muscles relax, help her get in better posture, and help her with her positioning on the horse. And so that's why Dink was chosen for Samantha.
We hope that this gave you good understanding about the benefits of hippotherapy and exactly what it could work on for children with cerebral palsy.